Generic prescription drug prices are dropping in this province. By the end of the month, you'll be paying half of what you do now. An agreement between the government and pharmacists is designed to save taxpayers and employer or union-sponsored drug plans $380 million a year. A News reporter Mary Beth Burton has the details.
Right now, prescription generic drugs cost 65% of what brand names cost. With a new deal between the BC Pharmacy Association and the government, generic drugs will cost just 35% of brand price.
And by making these generic drugs more affordable, British Columbians will see increased savings at the cash register, and employers and pension plans will also see savings on their drug plan costs.
To compensate, dispensing fees to pharmacists will slowly climb from $8.60 to $10.50 a prescription.
As of October the 15th, Pharmacare will pay pharmacies a markup of 8%, which is intended to cover their procurement, distribution, and inventory costs. That is an increase from the prior rate of 7%.
The reduced generic drug prices only apply to products covered by Pharmacare.
The basic patient in British Columbia will benefit. They will see lower drug prices, and they will also see basically no further charging from the pharmacy once they reach their fair Pharmacare maximum.
About 50% of all drugs dispensed in BC are generic, but they only make up about a quarter of the money pharmacies bring in. And while some of the larger pharmacies may not be affected by these changes, smaller ones like this one in Cadborough Bay certainly could be. Pharmacist Ian Lloyd says in some small operations, drug sales make up more than half of the overall business.
It'd be more concern for the small community pharmacies, the mom and pop businesses, whereas the rebates we hear about, it's not the gravy. That is our bread and butter. That's what keeps us going.
When the province of Ontario dropped generic prices to 25% of brand price without consulting pharmacists, several operations went out of business.
I don't think that's going to happen in BC. The Ontario agreement is much more drastic towards pharmacies than the British Columbia agreement. The British Columbia agreement is quite a reasonable agreement.
The 3-year agreement also includes a plan to reinvest $35 million in new clinical pharmacy services.
The big role, I think, of pharmacists in the future is not dispensing medications. That's what technicians can do. The big role for pharmacists in the future is direct patient care services, direct patient consultations, medication management programs, giving vaccinations, working with the other healthcare providers to provide a best possible therapeutic outcome from drugs.
The cost of generic drugs drops July 28th. In Victoria, Mary Beth Burton, A News.